Good evening. Thank you for joining us today, and welcome to the webinar on potential changes to long-term care. We're very happy to be able to engage Nebraskans who may not have been able to make our in-person listening sessions. My name is Camille Dobson.
And I'm Carol Sala.
And we're part of the team that has been hired by the Department of Health and Human Services to go out and engage Nebraskans in their communities. We're looking for your thoughts, questions, and concerns about the state's long-term care system. You'll see on the slide in the bottom right corner an email address. As we go through the presentation, this will be on the bottom of every single slide. We're encouraging you to send your questions and comments in real time while we're going through the presentation this evening. If time permits at the end, we'll try to answer them. But if we can't, we'll add them to the information we're gathering from our in-person meetings. If you have any difficulty during the webinar, please take a moment to write down the contact name and phone number for the folks here at Nebraska Educational Television who can help you with those issues. So without further ado, we're going to jump into the substance of the presentation and again encourage you to send in your questions and comments. Carol.
Good evening. What we plan to do in the meeting is do an overview of the project, give you some background information, Nebraska's initial thoughts on its new system, share your ideas because we do want to hear from you, and go over the next steps. What does long-term services and supports or long-term care mean? Well, some consumers shared that they do not understand what long-term services and supports are. So we are referring to this project as a long-term care redesign project. But if you say long-term services and supports, that works too. The state is looking at possible changes to their long-term care system for several reasons. The population is aging, the workforce is aging, Medicaid costs are growing, which means that the state is struggling to fund all its priorities, such as education, roads, and health programs, and long-term services and supports. So basically the bottom line is the way the current system functions now, it cannot be sustained. We are here because your opinions matter. We want to make sure that the public, consumers, providers all have an opportunity to express their concerns, their ideas, and what you see on this slide is a timeline of the project. Where we're at now is September, where we are doing statewide listening sessions, going across the state and meeting with the public, and then also doing this webinar. At the end of the year, there will be a draft redesign plan presented to the state, and then the next step would be that our team will be taking that draft plan back out on the road to do another round of statewide listening sessions to get input again from the public and Nebraskans on what their concerns or what their thoughts are on the plan. Toward the middle of the year, the state will plan to finalize their long-term care redesign. Our goal is to provide Nevadans healthier people, or Nevadans, sorry I'm from Nevada, Nebraskans healthier people, quality services, easier access to services, help to live the way they want and, importantly, where they want, help to figure out the services they need, have supports during health and care changes, and to have a system that helps providers help people. And it needs to be an affordable program. The focus of this redesign is mainly on Medicaid-funded services that serve individuals with disabilities, seniors, and caregivers. But we also want to hear about the ideas you have for other programs to support people living longer and healthier lives. We're going to go through 6 main areas, and we want to hear from you on how to improve how the system runs, how to assess the needs of people fairly, how to improve service coordination and case management, how to help people receive services and support, how to make it easier so that more providers participate, and how to improve the quality of services. So the first place we're going to start is how to improve how the system currently runs. We're finding issues in the current system include different programs, different rules between programs, different options between programs, different services offered between programs. All of this can lead to confusion and delays in accessing services. So we would like to hear from you. We would like you to share your ideas. And again, there's an email address at the bottom of every slide. So throughout this presentation, as we go through the different slides, if you have ideas, please send them to this address, and you will also have an opportunity to do it over the next few months. So what services do you think work well? What changes would make it easier for you, consumers, providers, families? What current practices make it hard to access services? What other services would help you achieve your goals? And how would you like to enroll into services? The next topic area is how to assess the needs of people fairly. The issues with the current way services are and needs are assessed are people's needs are assessed differently between programs. The services you can get depends on your assessment, and services are also different in each program. We would like you to share your ideas on what changes could be made to make sure that people are assessed for services fairly, and how can the assessment better be used to determine how and what services a person receives. We're looking at how to better coordinate care. That could be called service coordination, care management, case management. These are all different names, but the same concept. Issues in service coordination and case management include that case management is not available for people getting home health services, personal assistance services, and private duty nursing. We're finding that not all people who need help with finding providers, access to care, or services get that help that they need. Service coordinators are often not aware when a person has a health crisis and may need more services. And there may be conflicts in providers helping people to plan for their services and providing those services. We would like to know what kind of help navigating the long-term care and healthcare systems would be most useful to you. Are there any groups that need more help than others? What types of person or organization is best to help you coordinate your care? And what do you think person-centered means? And what changes are needed to the system to make it person-centered?
Taking over from Carol, the next topic is how to help people receive services and supports. And this is really about understanding the system and how you can get the services you need. So what we've identified already, the state has identified that several of the long-term care services are very similar in the type of help that's provided to consumers. We find that people may be getting services from different programs at the same time without the programs knowing about one another. We understand that policies and training are not the same between programs, and some services aren't available to people who could benefit from them based on what program they're in. So all that's related essentially to the prior issues that Carol talked about around assessment and the differences between programs. It really has an impact on folks getting the services they need. And so what we're interested in is changes that could be made to make sure people receive the services that they need, How do we make changes to ensure that people who have new healthcare needs actually receive the help they need? And how could we improve the communication and coordination of services between different programs and services? Next, we turn to providers, because without providers, it's very difficult for anyone to get services that they need. And we found a number of issues that we're interested in hearing from you about. And that so we've identified that, again, the way of managing providers are different depending on the program that the provider participates in. Reimbursement rates are not the same between different providers that provide similar services. And we know that different payment rates exist across the state for different programs. So we're interested in primarily recognizing the provider shortage that there is in the state. How can we make sure that we have providers that can provide the highest quality of care? Understanding that there are constraints and concerns about maintaining the state's budget, are there ways to improve the way that the state pays providers? Can the process for submitting claims for payment and getting paid be improved? And if so, how could we do that better? And then finally, are there ways to make the process for becoming a provider simpler, minimizing that burden, but while still making sure that we do the proper screening to make sure that providers are qualified to deliver the services that they want? Moving on to quality of long-term care services, which is a very important piece sort of underlying the entire system. And what we found is that today we really don't have a good way to measure the quality of the long-term care services that individuals receive. And we want to make sure that they're of the highest quality and they actually make a difference and improve the lives of Nebraskans. So we're interested in hearing what kind of information should we collect to make sure that people are getting the right kinds of care? What information do we need to make sure that our services are effective? Are they doing what they're meant to do for the consumer that's receiving them? What are the best ways to measure how the system is doing? And in the end, what really matters to you? Because quality is about you and how the services you get make a difference in your life. And so helping us understand that will help us build a quality system that works. Finally, we're going to talk a little bit about how to improve the way that care is delivered in the state. The priority is to make sure that whatever new system is put in place or changes to the current system are put in place, that it meets the needs of the people who need services. And what we find today is that long-term care services continue to be managed, delivered, provided in a separate system from the rest of the healthcare. So there are different computer systems, there are different care managers, there's different payment systems, there are completely different sets of providers that are interacting with consumers on a regular basis. One of the ways to deliver service that has been promising in other parts of the country is managed long-term care system, because that promotes whole person health care and makes the system less fragmented. So there's one care manager and there's one entity that's responsible for all of the services that a person might need. If the state goes in that direction, there are lots of changes, lots of questions about the changes on how the state provides care, and there's still lots of details to work out. So we're very interested in understanding your thoughts about the redesign. So should there be major changes? What are the biggest challenges in changing the system? What steps should the state take between now and any changes that are made? We're interested in understanding what services you're most afraid of losing in the change. We're interested in hearing about good things you've heard about managed long-term care and what you have heard about that you want to make sure that we do not do in Nebraska. So both the good and the bad will help inform the new design of the program so that it is the best system for Nebraska. So our next steps are we're continuing to hold listening sessions across the state. We are reading every bit of information that you send to us, emails, letters. We're obviously meeting across the state. We did 4 sessions last week, a couple today, and we'll be out in western Nebraska next week. And then we'll present a redesign plan based on your feedback and what we've learned from the state and the current system, and then ask your thoughts in the spring. So here are the dates for this, what we're calling the statewide listening tour. As you can see, on the left-hand side, we've completed those visits through today. And next week, we'll be in Kearney on Monday, North Platte on Tuesday, Wednesday in Scottsbluff, and Thursday morning in Gearing. So at the bottom of this page is the web page link for the Medicaid and long-term care divisions page that's talking about redesign, and all of those dates and the specific locations where we'll be next week are listed there. And that page is always updated, so we recommend that you subscribe to continue to remain informed of all the changes that we're making. There's the link again to the Medicaid page. And then the email address that we've been talking about, nebraska.gov, there's a second email address that is not a Nebraska government email address. If there, for some reason, you're more comfortable sending your comments and your thoughts to an address that's not the state, that comes to our team that's been contracted with the state, and we'll summarize those, de-identify them, and provide that feedback to the state as part of our sort of summary of all of the things that we've heard. We urge you also to follow us on Twitter if you're a Twitter person, and as well on Facebook, because information is posted there as well. So as many ways as we can get information out to you, that's what we want to do. So I'm going to pause for a minute and see.
This is Carol again. We have received a couple of comments, no questions yet, but there's a couple of comments, and I will share those. One person said it would help if all approved providers could be accessed by any program. A respite provider approved by one program should be easily viewed by DHHS, Aging Office, and Independent Living easily, and should be able to see other providers too. So in other words, what this person is saying is that a provider could move across the different programs and not be just strictly a provider for one program. There is another comment that came in that says that providers should have a standard rate across the board for basic provision of services, or for basic providers without additional training, and specialized providers which are providers with some medical training. So these are the kind of comments that we are happy to hear, and we'll be summarizing and taking back to the team to work into the redesign draft. I'm not seeing any other questions yet or comments coming in over the email.
So I think what we'll do, we moved through that obviously very quickly. You obviously don't have a copy of the presentation in front of you, but what you can do is go on to this page linked at the top, the Medicaid long-term care page, and the PowerPoint, the slide presentation that we just did is there, available for you to download and look at your leisure. It's the same content that we're talking about in the public meetings that we're having in each of the cities. So we urge you to send this information to your network, to your friends, your family, anyone that you know that is receiving long-term care services, and urge them to give their input. We're very anxious to reflect the consumer and provider perspective in any redesign plan that we offer to the state.
And this webinar is being recorded. It will be placed, there'll be a link to it on the MLTC website, Long-Term Care Design website. So it can be viewed at any time once it's placed on their website. As far as comments and questions, we encourage you to continue to send those in. This is not the only opportunity to do that. The public meetings are not the only opportunity to put your comments in. We want to hear from you over the next few months, so if you think of something that you want to state or a question you want to ask, please use one of these mailboxes and send your comments, your questions, your concerns, your issues, anything you want to see that you think was working well, that you would not like changed. Please use those email links to let us know.
So we don't want you to disconnect from the webinar, because as exciting as this was, this is not the only content for this evening. Courtney Miller, who is the director of the Division of Developmental Disabilities, will be talking to us at 6:30, and so we urge you to get up, take a break, maybe go get dinner, and leave your computer or your phone up with the website, with this link up, and Courtney will be on in a half an hour to talk. So it's been suggested that maybe we can talk a little bit about what we've been hearing at the public meetings and the common questions that people are asking. So some of the things that are coming up that we've heard are that people are very challenged about how to access the system. They're finding it very difficult to understand where to go to, one, know what they're eligible for, and then once they're eligible, what kind of services they can get. And so one of the areas that I think we're very interested in focusing in on is on that front door, and making sure that people are able to understand clearly what services the state offers, what they might qualify for, and then how to get started down that path. Medicaid is a very complicated program, and getting Medicaid eligibility can be a long and unfortunately time-intensive and confusing process. And so the easier that we can make that system for folks, the faster they can get the services that they need. So we've heard a lot about that. We've heard a lot of general fear of managed care, and I think rightly so. That is a big change in the system for a state that has not has been providing services directly through contracted providers. What I would tell you is that the state folks, the new leadership at the department is really understands you, that fear, and hears you, and I think is very anxious to understand your general concerns, looking at other states and what has gone well in those states, especially those states around Nebraska, what things have not gone well, and identifying ways to do things differently. So, will my services get cut? Will I be able to see my providers? How will I know who to contact? Do I have to carry around multiple cards? There are a lot of areas where good, clear communication and education is needed if the state moves in that direction. And so I think we agree as a team, feel confident that the state is taking a very deliberative approach, and will stop very frequently along the way to make sure that consumers, providers, advocates, anyone who touches the long-term care system is fully up to speed on any changes that are made before they move forward.
We've been hearing that there's a lack of knowledge, both between people trying to access the system. They don't know where to turn. They don't know who to call. They don't have a phone number that they can look up in a flyer or whatever to access services. And there's been a general agreement that training is important for both providers that might be referring people to programs, training and knowledge to workers that are referring people. So there was just a real general discussion on making sure that people know how to get the information. And some good ideas, even on ideas as far as simple flyers that with a phone number that someone can call to start asking for information.
We have heard feedback about providers in general, about the interest in certifying providers, making sure that they've got a standard of performance that's the same across the programs, much like the individual who talked about the hospice provider, making sure that there's, again, not just for consumers, but for providers, there's an easy way to get into the system and that they're qualified to provide services for different types of individuals and different kinds of programs. So we've identified sort of provider improvement as a concern. We have heard in a number of meetings about the difficulty that providers are currently having with the provider screening and enrollment contractor, and we know that the state staff are working very diligently to address those concerns rapidly and continuing to make improvements to streamline and make that process smoother. So hopefully it will be a temporary glitch in the system, and things will settle down, and we'll find that that's not a barrier to getting your providers enrolled in the system.
We did just receive a question, and it had to do specifically with the webinar, that some people have been unable to access the webinar using links. A listserv was sent out, but with a corrected one, but that was too late for some people to get onto the correct link. So this person is asking if another live interactive webinar opportunity will be offered. And that will be up to DHHS administration to make a decision on whether another webinar can be done. But this webinar is being recorded and will be placed on the website so that it can be accessed at any time.
Right, so that people can replay it if they missed tonight's opportunity.
And then we would need you to, if you watched it at a later date, you would need to email your questions and comments to those email addresses, right. Either the one at Nashua or the one at nebraska.gov.
Right.
And then it wouldn't be real time like tonight, but you would still get your questions in there, your comments in there, and we would answer those and collect that information.
I think I'm trying to think of some other themes that we've heard from our listening sessions that we've done last week and this week. We did get a question: how will the redesign affect the job duties of service coordinators for individuals with developmental disabilities? That's a great question. I don't think we know at this point. It really depends on what kind of program sort of consolidation or simplification the state decides to move forward with. Clearly, the spirit of engagement and transparency from the leadership of DHHS would lead me to say, without having talked to anyone at the department, that they would engage directly with those providers, the service coordinators, before any changes are made. Again, education and communication is key to managing change, which is always very difficult and complicated. So that's a really good question, and we will put that in there as a concern that we need to make sure that is addressed in the redesign plan. I think those are the main themes that we've heard thus far. We have heard a number of complaints about from providers who are serving clients in a neighboring state about the concerns in their managed care program, and again, those are heard loud and clear. And one of the key core values of a good managed long-term care program is that providers get paid and consumers get services, and other stuff sort of can be worked out. And so I think that the folks at MLTC and at DHHS have been talking with lots of other states about their systems, their programs, managed care or not managed care, about the way they offer services, and looking for really good ideas generally, and then figuring out how to apply those here in Nebraska. We have heard a concern about if managed care is decided to be implemented, that the state moves slowly, that they stop. Again, back to the same theme: education, communication, taking time to make sure everyone understands what's going to happen, and holding the health plans accountable for providing services to people. We have heard concerns about services being cut when managed care plans come in to the long-term care system. And I think we have seen in other parts across the country that's a function of good state management. And again, back to the leadership at the department who has every intention of holding any health plan accountable for their delivery of services. That's happening today in the new Heritage Health Program that is going to come out in January. There are lots of accountability mechanisms, ways to hold the health plans responsible and accountable for delivering services, delivering them well, paying providers on time, and making sure that high-quality services are delivered. What kind of oversight, so we got a question, what kind of oversight do you expect if the LTSS system does move to managed care? What is being planned now, and will you be able to avoid the negative publicity that is occurring in other states? I think the answer is yes. Obviously, no one wants the kinds of problems that might be happening in other states where consumers are not getting their services and providers aren't getting paid. The most successful states that have moved to managed care have taken a very aggressive role in oversight and management of their health plans, intervening directly with the plans when things aren't going well, having an open door, and lots of opportunities for feedback, real-time feedback into the department when the systems are changing over. You know, we call them early warning systems, but you can tell pretty quickly where there are problems based on talking to care coordinators, talking to consumer groups who are hearing from consumers on the ground where there are problems, hearing from providers who, you know, if claims aren't being paid early on, that's a real problem and needs to be addressed. So this is not an unknown activity. 23 states now have managed care plans delivering some long-term care services, or in some cases all long-term care services. And so there's pretty good understanding out there in sort of I call the policy wonk world about what are good practices for effective oversight. The key to remember, I think, is that it is still the state's program, regardless of who's delivering the services. And so the state is responsible, and so it's up to the state to build a really strong and effective oversight system, good quality, having the right staff, having staff that is skilled at the kinds of things they need to deal with managed care plans, and continuing to hold their feet to the fire. I'm fond of saying that the plans will do what you pay them to do, and so you need to be really clear about what you want them to do and pay them accordingly, and then hold them accountable, both programmatically and I think financially as well. So the state's very attuned to where things have not gone well, and also very aware of the good practices in states where managed care has gone well. So I don't think have any more questions. We're going to wait just another minute or two to see if anything else has come in. Either follow-ups from the answers that we just provided, or additional questions that folks have. We have heard a lot about case management and sort of not knowing who to call. I think that ties back to education and having knowledge, consistent information out so that you know what it is you're supposed to have. I think Courtney will probably touch on this, but she's said that, just simple brochures and pamphlets that explain what services are available in each program, something pretty straightforward and basic that would allow people before they enter the system to know what kind of services are out there. I think we've had questions about how waiting lists for developmental disability services will be affected. And the hope is that in some, ideally, more individuals will be able to be served. Again, with the resources that the state has available, that's a challenge. And so to be able to serve more people, it needs to be more effective. We have heard in a number of the sessions so far what we're terming the cliff for children, particularly with developmental disabilities that are in the education system, and what happens when they age out and move to the adult system, the differences in services that are available, the fact that parents don't know what to expect, that there are new processes to go through to continue to get services for the now young adult, and so points to opportunities to engage with partners in the education system and the vocational rehab system to make sure that those transitions are seamless, and that there's good information about what's available and planning for parents who know that 19 is coming or 21 is coming, so that they can build in time to do all the things they need to do to make sure that appropriate services that are right for their son or daughter are available and ready to go. Okay. I think we have covered all the questions that has come. I think we've hit all of the elements we've heard so far from the public comment period. There may be things that we talked about today that we didn't talk about today that you think are really important. Again, we urge you to send your comments and your feedback to the email addresses that were on the slide deck, to download, if you can get onto the website, to look at the presentation and have it available for you, and to share the information about the listening sessions out west for next week, and continue to stay engaged. And we're looking forward, our team is looking forward to coming back in the spring to talk about the plan once the department has determined where they might like to go in addressing all the challenges that we talked about today. So again, I will urge you to stay tuned. Courtney Miller, the director of the Developmental Disabilities Division, is going to come on to provide an overview of the services and the issues that are sort of underway in the developmental disabilities world. That webinar or that presentation won't be recorded for later viewing, so if that's something that you're very interested in hearing about, we urge you to stay tuned or to click back in at 6:30 when that starts. And thank you again for your viewing today, and we look forward to hearing from you.